Data is always going to be, I think, the constraints in industry, whether it's training your models or validating them. I think there's an increased appreciation that we need differentiated sources of data. A-alpha is hopefully going to play some part in that ecosystem, but we need more than just a handful of companies. And I think the second thing I hope your audience walks away with is with the right data, AI can be an incredibly powerful tool in accelerating your work. That said, everyone would be forgiven for being confused by the claims of many. And so I would just encourage diligence as we watch this space unfold.
Welcome back to part 2 with Troy Lionberger from A-alpha Bio. In the first half, we explored why protein-protein interactions are so fundamental yet historically difficult to characterize, the limitations of traditional antibody discovery methods, and where de novo design fits into the picture. Now we dive into the solution, how A-alpha Bio's platform generates massive datasets at unprecedented scale, what happens when you feed 1.7 billion measurements into machine learning models, and why this data revolution is transforming therapeutic development. Let's jump back in. Are you juggling the complexities of CMC development while trying to enjoy the beauty of biotech? Have you ever wondered if there's a way to simplify bioprocessing? Welcome to the Smart Biotech Scientist podcast, where we're diving headfirst into the very challenges you face. We're breaking it down, demystifying the jargon, and giving you the keys to unlock your full potential. I'm your host, David Brühlmann, and I get it. With 15 plus years in the biotech industry, I face the same challenges you do. There's a way to simplify and streamline so you can remove complexity, you can skip trials and errors, deliver without delay your groundbreaking therapy to clinics and market, and still enjoy every single step. Do you want to learn how industry experts and I did it? Grab a cup of coffee and your favorite notebook and pen. Now is the time to take your bioprocessing game to the next level. Let's smarten up biotech. Now, I would like to move on to the machine learning and data in general, because AI and machine learning are powerful, but they depend on good data. I always hear my former boss, he was quite skeptical about technologies. He always told us garbage in, garbage out. And that's very true for modern technology, for AI. You need good data. And currently there's a limitation because the engineering models today are limited by the public domain data. So can you paint us a picture of how does that look like and what are the impacts today on drug discovery?
I think when we look at modern protein engineering models, I mean, many of them have been trained, as you said, on public data. In that case, it's typically the PDB, so the protein data bank, that is being referenced in many of these cases. And just to put a perspective on that, there are little more than 10,000 antibody structures of antibodies bound to their target antigen in the PDB today. So when you compare 10,000, the number 10,000, to how much data has been generated to train ChatGPT, for example, or other large language models, I mean, there's a 10 order of magnitude difference between the amounts of data that has gone into like generalizable machine learning models and large language models compared to what data is available for brilliant protein engineering teams today develop their next model on. The constraint is really felt when the biggest failure mode in many of these models is what they call hallucinating. So if you have one example of a solved structure that you're training your model on, it's actually quite difficult to then ask the model, if I make a mutation in one of these residues, will my molecule still bind? And if so, how tightly? Oftentimes, these models are hallucinating because they've seen the structure before. There's a minor modification to it. So the tendency, the bias, if you will, is to revert to the solution that they've seen before. So what's missing is an ability to generate data that can give these models many, many, many examples of both positive and negative data. So being able to definitively tell this model, no, that aspartic acid was changed to an alanine. I know from my experiments it did not bind anymore. Now correct yourself so that you stop hallucinating, right? I mean, that's basically what we're trying to do with AlphaSeq, is generate large amounts of data that introduce minor variations to these molecules and directly tells these models not only do they still bind, but what is the strength of that binding interaction. And one thing for your audience to, I think, appreciate is when we talk about making generalizable models, I think the grand ambition in the industry is that we can one day teach a machine learning model physics. If you want to teach a machine learning model physics, the missing ingredients is not just the structures, a physical parameter like Gibbs free energy, so delta G. And it just so happens that affinity is directly related to delta G. So what the AlphaSeq platform is giving us is not just structural information, but also energetic information that is really going to be, I think, transformative in how these models ultimately are being predictive. And the predictive nature is going to increase the better they get at understanding the underlying physics.
Wow, that's powerful. That's powerful. Even physics, yeah. What can you do today with the technology, and what will be possible as you're building your models? If I'm not mistaken, you have measured 1.7 billion protein interactions, or I'm not sure if this is by your company or in general. Where is this going to lead? Also, my second question.
I think there are multiple layers to that. Right now, I think the latest count is 1.8 billion, but what's 100 million between friends, I guess. So that data has been used, and we generated that data in large part to train our internal models and also to do partnerships with therapeutic developers as well. To answer the first part of the question, what are we doing today? Today, we're offering access to our platform under fee-for-service arrangements. Someone comes to us with an antibody that they want to diversify or increase the affinity of or make more developable. We have a very standard process now that 3 months later, these customers are getting what they want, and it's very easy for us to do this work, so we're happy to do it. Where I think things get more challenging is our applications where you require multiple iterations of the AlphaSeq platform. So what I just described as a kind of fee-for-service, someone comes with a molecule, we'll improve it for them. That requires one iteration, if you will, of our experimental platform. For more challenging examples, I'll give you two. One would be work we did with Gilead, where we were able to essentially optimize biologic specific for HIV. So to make a neutralizing biologic for HIV, the challenge that was put in front of us is, can you make a molecule that can hit not just one or two versions of HIV variants that are present in the population, but over 800 variants? If you had asked me before I joined this company 3 months ago, if it would have ever been possible for someone to optimize a molecule against more than 800 different variants of target, I would tell you there's just no way. You might get one or two, but not 800. And the fact that they were able to simultaneously improve the efficacy of this molecule for virtually every variant of HIV available is really exciting. And I think that, for clarity, took 3 turns of the crank. So that's how powerful I think things get when you iterate a few times on this. Another example that I'll give you that I didn't think possible before 3 months ago is reliably and reproducibly making biparatopic molecules. So what I mean by that is, in most cases, the parts of antibodies called the variable chain that ultimately interact with your target antigens, typically they will bind to a single antigen. So one variable domain, one target antigen. What are called dual specific antibodies are those that actually have the ability to have that same domain bind to 2 different antigens. That I've seen a few kind of examples of in the past where it was serendipitously discovered. And I think a lot of therapeutics historically has been kind of serendipity. It's bespoke and artisanal. We're getting to the point where now these things are tractable and systematic. And this is one example where we can now almost arbitrarily introduce two different paratopes into this antibody and have them interact with two different antigens. And this opens up all kinds of unique modes of action and safety profiles for therapeutics that really haven't been possible before. But this is where this ability of AlphaSeq and AlphaBind to kind of reproducibly engineer these molecules is, I think, quite exciting.
Yeah, definitely. That's quite exciting. And it's powerful to have all these tools at our disposal. And now this leads me to the next question, because if you're developing your company, especially if it's a smaller company or mid-sized company, you always have the question, well, we do have very knowledgeable and successful CROs. We have service providers. We have all kinds of technologies. So what do we do in-house? What is the capability we're building in-house? What is the knowledge or the understanding we want to generate in-house versus sourcing out? So as you're working with different companies, what is your observation or your recommendation, Troy?
I think you're right that many companies want to keep their core intellectual property and contributions to these molecules in-house. I absolutely understand the tendency to want to do that. I think my response is there's a reason that everyone decided to move to MS Word instead of typewriters. I mean, like at some point we realized that there are more efficient ways to move forward, and I think it just comes down to dollars and cents. The reality is that these therapeutic developers, they don't want to be spending their time engineering molecules, if we're honest with ourselves. I mean, what they want to be spending their time doing is de-risking molecules, not making them. And so the quicker that they can get to de-risked molecules, the better for everybody. And that is really where I would encourage those in the field to ask the question, could you accomplish more faster and cheaper than service providers? Where the answer is no, then everyone uses a service provider. That is really how we're operating now in many of our applications. We're simply trying to accelerate these teams by making their work easier, faster, and cheaper, and more importantly, de-risking that entire process, because we're quite confident that we will be able to ultimately deliver a molecule. There isn't this question as much anyways in terms of risk. I mean, we haven't yet gotten a project that we haven't been successful with. Another aspect of this is just mitigating the risk overall.
Troy, before we wrap up, what burning question haven't I asked that you are eager to share with our biotech community?
If I'm honest, there's something that we're really excited about. It's coming and we've been talking about it publicly, so I'm happy to share it here. But back to this question about if you were ultimately limited to the entirety of the PDB and you only had 10,000 structures to train your models on, what can we do about that? Crystallography is not going to solve that problem. We have 10,000 structures, a few hundred are added a year. I mean, that's not going to give us the scalability that we need ideally for these models. And I think if I were to kind of predict where the field is going, at least on the ML and protein engineering side, I think there's going to be an appreciation soon across the industry that synthetic epitopes end up being an indispensable tool for training these models. And this is something that's taken me a bit to get my head around, so I'll try to distill it. But the basic idea is if you have one antibody, it will bind to one target. But that's not necessarily always true by physics. You could design other antigens, synthetic antigens, specifically to bind that same antibody. So we've been working on something called the Synthetic Epitope Atlas. This is a program that ultimately is generating predictions about synthetic partners for antibodies for the purpose of validating that we can actually see a structure and measure the delta G for that particular interaction. And even though these data are purely synthetic, these binders do not exist in nature, we are showing that you can actually train a model almost just as well as the PDB, but on things that don't exist in nature. Just because you're teaching these models structures, epitopic diversity, and feeding it with delta G and affinity measurement. That for me is really exciting to be a part of at the early days. I think increasingly we're starting to hear word on the street that more and more are doing synthetic epitope development for the purpose of machine learning and training machine learning algorithms. So we're quite excited about where that's going to go. And just to put this into perspective, I mentioned there are 10,000 antibody structures available to train your models on. In just one of of our measurements, we've shown that you can generate about 1,000 viable structures that are all validated and 29,000 confirmed non-binders. So molecules with simple mutations that break that affinities. There's 30,000 different measurements that we can then use to train models with. That's pretty exciting when you think about essentially alternative to the protein database is going to ultimately grow.
Yeah, that's exciting. With all that we've covered today, what is the most important takeaway?
Most important takeaway I hope your audience walks away with is, first of all, that data is always going to be, I think, the constraints in industry, whether it's training your models or validating them. I think there's an increased appreciation that we need differentiated sources of data. A-alpha is hopefully going to play some part in that ecosystem, but we need more than just a handful of companies. And I think the second thing I hope your audience walks away with is, with the right data, AI can be an incredibly powerful tool in accelerating your work. That said, everyone would be forgiven for being confused by the claims of many. And so I would just encourage diligence as we watch this space unfold.
Troy, this was fantastic. Thank you so much for sharing your insights, your perspective on where drug discovery is moving towards. Definitely exciting times ahead. Where can people get a hold of you and learn more about your technology?
Yeah, our website is aalphabio.com. We have a lot of information on the website there. You're welcome to peruse it. You're also welcome to connect with me on LinkedIn. We would be happy to connect with your audience.
Excellent. I will put the links in the show notes. So smart biotech scientists, please reach out to Troy. And Troy, once again, thank you so much for being on the show today.
Thank you, David. It was good seeing you.
What a conversation. From measuring billions of protein interactions to predicting the next generation of therapeutics, Troy Lionberger has given us a glimpse into the future of drug discovery. The integration of high-throughput biology and machine learning isn't just incremental progress, it's much more, it's transformational. If this episode sparked new ideas for your own work, share it with a colleague and leave a review on Apple Podcasts or wherever you listen. Thank you so much for tuning in. Until next time, keep innovating. All right, smart scientists. That's all for today on the Smart Biotech Scientist podcast. Thank you for tuning in and joining us on your journey to bioprocess mastery. If you enjoyed this episode, please leave a review on Apple Podcasts or your favorite podcast platform. By doing so, we can empower more scientists like you. For additional bioprocessing tips, visit us at smartbiotechscientist.com. Stay tuned for more inspiring biotech insights in our next episode. Until then, let's continue to smarten up biotech.